The novel coronavirus COVID-19 is currently causing a great variety of changes in the world simultaneously. What were once common practices are no longer so, and the world is facing a historic turning point. The medical industry is also facing new challenges to reduce the risk of infection and severe illness, in addition to existing challenges such as increasing healthcare costs due to an aging population. Development of diagnostic and treatment methods to enable early detection and treatment are needed more desperately than ever before. COPD is a chronic respiratory disease found in many severe COVID-19 patients and an example of a disease in which early detection is essential. Despite the current pandemic, there is a new technology that may change common existing healthcare practices by providing an entirely new option. Dynamic Digital Radiography, DDR, from Konica Minolta. DDR is configured with a general-purpose radiography system that can transmit a sequential pulsed X-ray to capture motion images. Since DDR has the same configuration as a conventional X-ray, it is easy, non-invasive, and repeat examinations and contrast agents are not required. In addition to anatomical information, which conventional chest X-rays can provide, DDR can visualize and quantify physiological information as well. In the near future, DDR will be used to achieve early detection and treatment of chronic respiratory and articular diseases. Konica Minolta aims to be a leading company that opens up a new market with its unique technology. Let's explore the value that DDR brings to clinical departments. First, thoracic surgery. Pleural adhesions and invasions are very difficult to observe with conventional chest CTs. DDR can provide visualization of respiratory motion to help judge the existence of adhesions based on abnormalities such as lack of lung tissue motion. Determining the existence of adhesions beforehand makes it possible to select the best surgical procedure, such as whether to perform a thoracotomy or a thoracoscopic surgery, leading to the reduction of operation time and the workload for surgeons and other staff.
最初見たときは肺野全体が立位で呼吸しているパターンが初めて見れた。生まれて初めて見たんですね。簡単に言うと。なのでちょっとびっくりします。一番変わったのはやはり癒着しているところが、すごく呼吸するんで癒着しているところは動かない。癒着してないところはよく動くっていうのが目に見えて分かったので、そこは良かったと思います。CT では形状は分かりますけど、癒着しているかどうかまでははっきり分かんないです。癒着の範囲と程度が事前に分かるかで、だいぶ術式とあと手術時間、輸血する準備類、血液量がだいぶ変わってきます。
Next, the cardiovascular department. DDR exhibits its power in the cardiovascular field as well. Pulmonary thromboembolism, sometimes referred to as economy class syndrome, and pulmonary hypertension have been on the rise in recent years as the population ages. Contrast-enhanced CTs and pulmonary scintigraphy are used as standard diagnostic methods. However, accessibility to scintigraphy is limited as few facilities are equipped to perform them, and they also require the use of drugs for testing. Because screenings such as D-dimer are imprecise, contrast-enhanced CTs are often used immediately and, depending on the patient's condition, do not show abnormalities in many cases. There is also a high burden on the patient due to radiation dosage and risk of allergies to contrast dye. If DDR enables visualization of pulmonary circulation, it will make diagnosis simpler, less invasive, and less expensive than existing methods, and help reduce unnecessary procedures.
肺の血栓塞栓症に使えるなというのが一番最初に思いました。造影 CT をオーダーする、肺血流シンチグラムをオーダーする。 1週間、時によってやっぱこう1ヶ月ぐらい待たないといけないとかいうようなことがあります。単純写真の画像と同時に肺の血流が分かるような画像がついてくる。これは非常に主治医の側からすると大変メリットのあることだと思います。侵襲性が低い。で、低被曝で撮れると。で、かつ場所も取らずにアクセスが良くて、簡便であると。非常に大きなメリットを持ったシステムで、それで肺の血流が分かるっていう、いろんなものに使えるシステムだとは思います。
Next, the Respiratory Medicine Department. COPD is one of the most common chronic respiratory diseases. Approximately 400 million people worldwide suffer from it. By 2030, it is expected to be the third leading cause of death in the world. Due to low awareness of it, developing or suspected COPD patients tend not to visit a medical facility, and hence they are diagnosed at a severe stage. This leads to increased healthcare costs and reduced labor productivity. Use of spirometry, the gold standard for pulmonary function tests, has recently been severely restricted due to the concern of droplet and aerosol generation by procedures conducted in small test rooms. By visualizing and quantifying pulmonary functions with DDR and providing this information as a new diagnostic tool, it makes it easier to detect abnormalities in pulmonary function at an earlier stage. If more people receive DDR examinations, such as during annual health checkups, it will greatly contribute to the early detection and treatment of COPD. Furthermore, due to COVID-19 pneumonia, portable radiography has become increasingly important. Portable radiography is essential in environments where infection control is required. In particular, many patients with severe COVID-19 pneumonia develop pulmonary embolism complications. DDR can be used to check whether or not there are any perfusion defects caused by pulmonary embolisms for COVID-19 patients that are admitted to an ICU. The condition of patients in an ICU can change hour by hour. Making additional pulmonary function information, such as pulmonary ventilation and perfusion, available with DDR in addition to anatomical findings helps to clarify the patient's condition promptly and more easily. Another field where the application of DDR is expected is orthopedics. It is said that no one had previously seen the bone movement of the cervical vertebrae, lumbar vertebrae, shoulder joints, elbows, and knee joints in a live human. By capturing and quantifying joint motion with DDR, it becomes possible to evaluate joint motion in a more objective way. This will be a useful indicator in a variety of areas, including diagnosis, treatment, and rehabilitation. In the near future, Konica Minolta aims to expand DDR beyond specialists into the primary care segment, including primary care clinics and emerging countries. Use of AI and the new DDR assessment tool will enhance diagnostic support for physicians and raise the level of healthcare. A wide range of differential diagnoses can be performed by making use of DDR and AI. Even medical facilities such as primary care clinics, where advanced examinations such as CT and MRI are not available, will be able to differentiate diseases easily, and hence, the patient pathway will be optimized. It will lead to early detection and treatment of diseases, which will contribute to enclosure of patients to the medical facility. In the future, Konica Minolta will evolve this technology in various fields, creating opportunities for many other players to enter the market in addition to developing its own business. DDR will become an indispensable examination tool. Konica Minolta will continue to use its proprietary technology to serve all healthcare professionals. It is time to shift from static images to dynamic images. Konica Minolta's new technologies will create a new pathway for the future of healthcare.